Welcome to Orthopedic Commandments. The purpose of this video is simple: to give you the tools that you need to appropriately image, diagnose, and verbalize orthopedic injuries without too much verbal trickery. The first orthopedic commandment that we're going to be covering is, "Thou shalt image above and below the fracture." Bonus points for doing a physical exam above and below the fracture as well. This looks like a simple ankle fracture at first glance. But what is this? Is un mazasuckers. If you're not imaging above and below the joint, you may miss associated injuries. Commandment number 2, thou shalt get 2 views, usually an AP and a lateral. Without an associated clinical picture, this image may indicate a simple jammed joint. It's not until you get the lateral image that you see a significantly displaced and dislocated distal phalanx requiring reduction. Commandment number 3, thou shalt do a distal neurovascular exam. Here you see radiographs that show a distal radius fracture with some volar angulation and anterior displacement. But this is what that patient's hand looks like. You can see the blue color of their skin, and I will tell you that their skin was cool and pulseless. Without a good neurovascular exam, you're clinically in the dark. Commandment 4, thou shalt give antibiotics and irrigate if the fracture is open. What kind of antibiotics depends very much on the kind of openness of the fracture. For a simple poke hole fracture such as this, you can get by with 1 to 2 grams of Ancef. For something a little bit more complicated, such as this poor gentleman's leg, you might want to give some broader spectrum antibiotics. Either cefazolin with some gram-negative coverage, such as gentamicin, or possibly ceftriaxone. You should discuss the antibiotic coverage choice with your orthopedic consultant, which brings me to Commandment 5. Thou shalt use your words. This is important for a number of reasons. It's important medical legally, it's important when you're communicating with your orthopedic consultant, and it's also frankly important when you're consulting Dr. Google online. If you cannot describe a fracture with your words, you cannot appropriately use your resources. Okay, let's dive in. The first thing you need to do when describing a fracture is describe its location. Is it proximal? Is it distal? How many centimeters is it from the articular surface, or is it articular? If there is bony anatomy you can use to pinpoint the fracture location, do so. Is it at the head, the neck, the shaft, or the base? For example, this fracture is located at the humeral neck. The fracture lies close to but does not involve the articular surface and does appear to involve the greater tuberosity. Once you've communicated the location of the fracture, you then must describe the fracture. Is it oblique? Is it spiral? Is it transverse? And how many chunklets is that fracture making? Is it a simple fracture with only 2 chunks? Segmental with 3 chunks? Or is this bone shattered? Are we dealing with a comminuted fracture? For example, this proximal humerus fracture is a transverse fracture with segmentation of the greater tuberosity. Once you've communicated the fracture description and how many pieces of fracture there are, you then must communicate the relationship those pieces then have to each other. Is there displacement? If so, describe it in terms of percentages or perhaps centimeters. Is there shortening? This can also adequately be described using centimeters or millimeters. If there's any angulation, this is described in terms of the deviation of the distal fragment's projection from the expected projection of that intact bone. For example, this segmental proximal humerus fracture has some shortening and has minimal displacement of the greater tuberosity fracture. Let's do some practice. Look at this fracture. Where is it located? What does it look like? And what are its pieces doing? Feel free to pause the video so you can give yourself a chance to do it on your own. Welcome back. I see a fracture of the base of the middle phalanx. The fracture is intra-articular and significantly comminuted, with volar displacement of the distal fragment. Let's try this one out for size. I see a minimally displaced fracture of the distal radius. The fracture is simple and intra-articular without significant angulation, displacement, or shortening. Maybe third time's the charm? What do you see here? I see a simple transverse fracture of the patella with significant displacement, or in this case distraction, of the patella pieces. How about this fracture? I see a comminuted fracture of the femoral shaft with some dorsal displacement and volar angulation of the distal fragment. Okay, I'm done torturing you, but hopefully you understand the usefulness of these rules. Let's review. Rule 1. Thou shalt image above and below the fracture. Rule 2. Thou shalt get two views, usually an AP and a lateral. Rule 3. Thou shalt do a distal neurovascular exam. Rule 4. Thou shalt give antibiotics if the fracture is open. And Rule 5. Thou shalt always, always use your words. All right, guys, that's it for me. Go forth and prosper. You are gems and rock stars. Thanks for listening.